So we approach our Maine care planning strategies in two different ways. First, we look proactively. When we're looking proactively, our biggest concern is estate recovery. How do we protect what you have now so that if you end up in the nursing home, the state can't touch your stuff, right? The pros to proactive planning, you have far more control. You can save much more of your assets. You essentially can pick and choose what you save and don't save because you're outside the 60-month look back period. In a perfect world, you're outside the 60-month look back period. So you could essentially save everything if you wanted to. You're much more involved in your long-term care plan because you're setting out the rules for how you're going to be cared for if and when you lose capacity. And you can feel confident that you did the best you could to protect your assets for your future generations. The biggest con in this process is that in order to protect the assets in the best way possible, you are losing some flexibility with how those assets are then used. And you do have to surrender significant ownership rights. You still receive the benefit of your assets, you just don't own your assets. When we look at the other side of that coin, we're talking about crisis planning. Remember I said earlier that crisis planning means that Maine care is imminent. It is within the next couple of months. So the pros for crisis planning, well, first, what we're worried about in crisis planning is we're worried about getting you qualified. Estate recovery is a secondary concern. And obviously it's something that we're worried about, but we're much more worried about getting you qualified. So the pros there, we can get you qualified usually fairly quickly within a couple of months if needed. Sometimes within a couple of weeks if things look good. We can save some of the assets usually, not all. In a lot of scenarios, we can save roughly half, which is much better than the alternative, because the alternative to being able to save at least half is that you have to spend it all to get yourself qualified. And that's just, giving money away essentially, money that could have been used for your care otherwise. The con to crisis planning, you have less control over your plan. You're now kind of handing the ball to your agent and other generations to make sure you're cared for the way you need to be cared for. You're not protecting those maybe legacy assets that you have, like the inherited camp, the way that you would have done it if you'd had the opportunity. And the biggest con to crisis planning is that if you don't have a proper estate plan in place, if you don't have that financial power of attorney with gifting powers in it, we essentially can't do much of anything. The only answer at that point is to spend the money.